This presentation explores the distinct aspects of neurotrauma care across two age demographics, pediatric and geriatric. The clinical presentation, management strategies, and outcomes in neurotrauma vary significantly with age, influenced by developmental or degenerative factors. Pediatric considerations. Neurotrauma in children, often from falls, sports injuries, vehicular accidents, and, in some cases, child abuse, present unique challenges. Children's developing anatomy, high plasticity, and unique injury mechanisms require age-specific diagnostic and management approaches. Outcomes and recovery potential are generally favorable in younger populations, although long-term cognitive and developmental impacts are a concern. Geriatric considerations. In older adults, falls are the leading cause of neurotrauma. Comorbidities, polypharmacy, and age-related physiological changes complicate diagnosis and treatment, particularly when anticoagulation is involved. The recovery process in elderly patients is often prolonged, and outcomes are heavily influenced by pre-injury health and functional status. This presentation covers the epidemiology, mechanisms, clinical presentation, diagnostic approaches, management, prognosis, and prevention strategies for both pediatric and geriatric neurotrauma, providing a comprehensive view tailored to the age-specific needs and challenges. Topics. This presentation on age in neurotrauma critical care is structured around three key demographics: pediatric, adult, and geriatric. Each group faces unique challenges and requires tailored approaches in the management of neurotrauma due to variations in physiology, risk factors, and recovery potential. Pediatric. Children, due to their developing anatomy and high levels of physical activity, are particularly vulnerable to specific types of neurotrauma, such as falls and sports-related injuries. Their unique physiological characteristics, including increased plasticity of the brain, impact both their clinical presentation and their prognosis. However, children also face long-term developmental risks following neurotrauma. This section will cover common mechanisms of injury, age-specific diagnostic considerations, and management protocols that aim to support both immediate recovery and long-term development. Adults. Adults, particularly those in high-risk professions or with active lifestyles, encounter a different set of neurotrauma risks, including vehicular accidents and workplace injuries. For this demographic, the approach to neurotrauma management balances between swift intervention for acute injuries and prevention of complications that could impact long-term functional capacity.